All right, so the next thing I would like to look at is going to be the spleen. So I've got him flip back over into right lateral recumbency. So we're looking at the left side of his abdomen. You remember the spleen is going to live in the left cranial aspect of the abdomen. If you're looking at it, you start with the liver, is what I typically start at with most of my scans. I kind of follow the edge of the rib cage. So if I started with the liver, I'm kind of using the rib cage as my kind of guide to move my probe further caudally, and might need to do it a little dorsally as well. So I'm coming up underneath the ribs. So right now I can see the spleen in the near field up there. So again, the spleen is going to be hyperechoic compared to the liver. So I can see that. It's going to have a little bit of a hyperechoic kind of capsule around the outside of it. I'm going to come up. I'm going to decrease my depth a little bit because this is a very superficial organ that we're looking at. Now my focal zone, I'm going to adjust that a little bit too, and right about here. So, which is nice here. I've got this kind of in a long axis view again. You can see this large vessel coming in. It's going to be right about the middle of the spleen is going to be the hilus. So we've got our splenic artery, splenic vein coming through there. If I'm worried about any issues and you have a machine that has color Doppler, I always like to get a good shot of flow, making sure that your hilus has really good flow. So we do see some splenic thromboses occasionally. So I want to making sure that vascularity is looking good. I can check and open this up a little bit more, like so. Maybe decrease my sensitivity a little bit and actually look at that flow going through some of these major vessels and some of these little tributaries kind of going off in different directions as well, making sure everything looks good there and no areas of thrombosis. If there was thrombosis, sometimes you'll see that hyperechoic thrombose in the vessel itself. And then we're going to look for areas of hypoechoic regions of the spleen where they're not getting perfused anymore. So again, I got the sagittal view. I'm going to go all the way in every plane, come back medially, go all the way laterally. When you're making sure, don't forget to get the head of the spleen. If you remember where your anatomy again, you got that gastrosplenic ligament. So the head of the spleen is actually going to attach all the way up by the stomach. We see this a lot in like GDVs when the spleen also torses with your GDV because that splenic ligament is actually taking it with it and making it go for a ride. So when I do that, I'm kind of going up under the rib. I call it kind of like the paint can, popping a paint can lid. So if I'm up under the ribs, I really need to kind of pop the back end of my probe down, and that'll get me all the way up under the ribs and let me see the head of the spleen. So we don't want to miss any type of masses or any lesions up in that region. Everybody's good, I feel like, finding the body of the spleen because that lives caudal to the ribs, but that area that's just under the rib cage adjacent to the stomach is a little bit harder to get, but that's a good shot of the head of the spleen right there. All right. So coming back, making sure you get the entire tail of the spleen as well. Change my focal spot again, just a little bit more superficial. Get that a little bit brighter right there. Here we go. Nice. So again, we got a smooth echo texture. It's a little hyperechoic compared to the liver. We're looking at the area of the renal hilus. There's no kind of published normal sizes of width and diameter of the spleen. But if you're looking to kind of compare that from one scan to the next, a lot of times I'll measure the width at the area of the hilus just to keep a common area that I'm doing it for. We do see a lot of nodules. Again, just like the liver, a lot of our nodules are going to be very non-specific in nature. So if we see them, aspirating them would be a good idea. We can see things again like nodular or lymphoid hyperplasia, extramedullary hematopoiesis are two big kind of benign changes we see a lot. Then we will see metastatic disease or primary tumors like hemangiosarcoma, a lymphoma, or other common things that we're looking for in the spleen. We're seeing these kind of big old hemangiosarcomas. A lot of times we see a large mass that kind of distorts the shape of this capsule. It no longer looks like this nice elongated kind of shape on here, so we worry about that. We can see those. If there's benign lesion, if it is different masses in there, again, we can't say for certain it's hemangiosarc. If there is also fluid in the abdomen or has a hemoabdomen, as well as a large cavitated splenic mass, unfortunately, that does make us more worried about hemangiosarcoma. Lymphoma, sometimes we'll actually see, like in cats especially, this like honeycomb appearance or moth-eaten appearance that we're looking for. So we can look for some of those types of things as well. If they are some of these more benign lesions that we aren't as concerned about, against sequential exams is always a good idea. So examine them now and see what it's like in like 2 months from now. Okay, does it look the same? Not seeing any other changes or anything either, then it's likely more benign. Actually starting to get some pancreas, that left limb of the pancreas, into view here. But again, that's hard to see as a beginner, so we won't dive into that too much. What else did I want to mention about these guys? Splenic torsions. Splenic torsions I mentioned before. Anechoic areas. Sometimes there's even multiple parallel echogenic lines. I've heard that like lacy appearance before is another term has been thrown out there on them. Cats sometimes will actually have little accessory spleens. So if you can see the whole spleen, sometimes you might find a little piece of the spleen down by the pancreas or something too. They're just kind of cute. They're called accessory spleens, and that can be normal. I think it's even up to like 4% of the cats. We can see some of those in there. Histiocytic sarcoma is something else we can see in the spleen. Multiple myeloma, sometimes we're aspirating there. Just like the liver I mentioned before, if you are thinking about like a histiocytic sarcoma, mast cell tumor, lymphoma, occasionally the spleen might look 100% normal, and then you get samples of it, and it may actually come back abnormal. So always good idea to sample it if we've got them there to do it. What else? When we come back here, normally my splenic exam is done. If you go on just a little bit further caudal from the spleen, it's typically where the kidney is going to pop in. So now we start seeing kidney. We've got colon right there, so sometimes that makes the kidney a little bit harder to find. But we'll look at kidneys in a second. But if I change my depth and everything too, better shot of the kidney there. All right. But we will, actually saw a little bit of the adrenal gland coming into now already. Nice. All right, so we will look at our next organ in a second. Thank you, everybody.